Hello everyone. Very good morning to all of you. Am I clearly visible, audible? Give me a minute to confirm if I am clearly visible, audible. I will start the class ahead. Give me a minute. I guess I am. A very good morning. Yes. Just a second. Let me open the chat also. Give me a minute to open the chat. Okay, I can see the chat also. So very good morning to all of you. Am I clearly audible also? Someone from the audience give me a thumbs up in the chat box if I am clearly visible, audible, and you can see my PPT also. So Ashish, Priyanshi, Nikita, Raj, Surendra, Osama, anyone. Please give me just a thumbs up to indicate that everything is going smooth and we can start the session ahead. Can I? Someone is giving the thumbs up? Yes? I am waiting for the response. Okay, thank you Surendra, thank you for responding, thank you very much. So a very good morning, a refreshing morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to start a very important topic of pharmacology, that is pharmacodynamics. Now many students have demanded this topic on huge demand. This topic students usually find difficult. That's why I decided to take this topic on YouTube sessions. So I am going to teach you today DRC, which is known as dose response curve, DRC. Many image based questions and the graphs are going to come in your exam from this topic. Now whether you are a second prof MBBS student preparing for your university exam or whether you are preparing for any of the competitive exam, you will always get a graph in your exam. The graph will be from the Potency, Efficacy, Therapeutic index. So all will be resolved today in the dose response curve. So without wasting any further time, let me start the session. So before understanding what is dose response curve, you must understand that in pharmacology we are having two branches. What is pharmacology? Pharmacology is the science of drugs. It is a subject in which we study the drugs. So in the pharmacology we are having two branches, pharmacokinetics and pharmacodynamics, right? Now you already know it, so let me go it quickly. What is pharmacodynamics? What is the drug doing to the body? Drug doing the body. Just suppose for an example, I am having migraine headache. So what I will do? I will take a drug to treat it. Whatever is the treatment of choice, I will take that drug. I want to treat it. So what the drug will go inside me? I will take it by mouth, oral route. So it will go in the intestine. It will get absorbed. It will go in blood. From the blood, it will go to the CNS. It will act on the blood vessels of the CNS and treat my headache. So what the drug is doing on the body, that is mechanism of action of the drug. I mean mechanism of action of the drug, that comes under pharmacodynamics. So learn D for D. D, dynamics मतलब drug. Drug आपकी body पे क्या कर रहा है? Drug जो काम कर रहा है ना आपकी body पे, उसे कहते हैं pharmacodynamics. If I am having migraine, I want the drug to reach in the CNS parenchyma and treat it. If the patient is having diarrhea or constipation, I want the drug to reach in the intestine and act it. If the patient is having heart failure, I want the drug to reach on the heart. So first the drug goes in the blood, and from the blood, wherever the receptors are present throughout the body, drug will act on that organ. That is known as target organ. That comes under pharmacodynamics. The second portion is the pharmacokinetics. Pharmacokinetics. In pharmacokinetics, what the body is doing on the drug, that comes under pharmacokinetics. Just for example, if I am having again migraine headache, just looking at the drug, it will not treat me. I have to take it. So I want the drug to reach in the CNS, but I cannot directly reach it to the CNS. So body will help me in reaching. So I will take the drug by oral route. Most common route is oral route. So first the body will absorb that drug. First, the body will absorb that drug. See a simplified diagram. So this is the drug. I am taking it by oral route. I am the subject. Drug is going in the mouth. Drug is going in the esophagus. The drug is going in the stomach. The drug is going in the intestine. The drug gets absorbed from the stomach and intestine. Some drugs are absorbed from stomach, acidic medium. Some are absorbed from basic medium, intestine. Ultimately, the drug will reach in the blood. This step is known as absorption of the drug. So what is the definition of absorption? It is the movement of the drug from the site of administration till circulation. Circulation means blood. So this is the definition given in your books. The movement of the drug from where to where? From the site of administration till circulation. Once the drug is coming in the circulation, now I want the drug to reach at the site of action. It can be brain, it can be intestine, it can be heart. It depends what is the disease of the patient, right? So the movement of the drug from the circulation till tissue, that is the site of action. This step is known as distribution. So the second thing is body is distributing the drug. So first body is absorbing the drug, then body is distributing the drug. Drug has already shown mechanism of action here, which comes under pharmacodynamics. Okay. Now I cannot keep the drug forever in the body till, right? I want to excrete it. Drug has already shown its mechanism of action. Now I want to excrete the drug. So I will ask the drug to go in the kidney and get excreted out in the urine. So drug will say, okay, I'm going in the kidney. But in urine is water, you know. So only polar drug, polar means water soluble drug, will be excreted from the kidney. But most of the drugs are non-polar. They are not soluble in water. So how can you excrete a non-polar drug in the urine? You cannot do that. So before excretion, basically we have to convert non-polar drug to polar drug. That step is done in the liver, and this is known as metabolism of the drug. Metabolism of the drug. So liver is converting the non-polar drug to polar drug, that is water insoluble to water soluble, so that it can be excreted out of the body. Last step is excretion. So basically body is doing four things. Number one, absorption of the drug. Number two, distribution of the drug. Number three, metabolism of the drug. And number four, excretion of the drug. So absorption, distribution, metabolism, excretion, ADME is the mnemonic that comes under pharmacokinetics. फार्माकोकाइनेटिक्स में चार चीजें आती हैं. बॉडी ड्रग पे क्या कर रही है? सबसे पहले बॉडी ड्रग को एब्जॉर्ब करती है, फिर उसको डिस्ट्रीब्यूट करती है, फिर उसको मेटाबोलाइज करती है, फिर उसको एक्सक्रीट करती है. एक्सक्रीट करने से पहले मेटाबॉलिज्म जरूरी है. यू कैन नॉट डायरेक्टली एक्सक्रीट अ नॉन पोलर ड्रग. If the drug is polar, you can skip metabolism because it can be excreted directly. But most of the drugs, as I have told you, they are non-polar. So first you have to metabolize it, then they will be excreted. Come on, give me a thumbs up. Are you people there? Shall we proceed ahead? Right? So ADME is the mnemonic. So that comes under pharmacokinetics. We have studied in pharmacology, we are having two branches, pharmacodynamics, pharmacokinetics. Pharmacodynamics, what the drug is doing on the body. Pharmacokinetics, what the body is doing on the drug. In pharmacodynamics, we have mechanism of action of the drug, only one thing. But in pharmacokinetics, we are having four things. ADME is the mnemonic. Absorption, distribution, metabolism, excretion. So here comes mechanism of action, here comes ADME. Everyone first give me a thumbs up, that is the basics. You must know. If you got the basic, can you answer three things? Three questions, three MCQs? Yes, you can. Can you read the first question for me? Pharmacokinetics include all of the following except. I am asking about pharmacokinetics. Read the four options. Osama, read the four options. Aditya, Raj, what is the answer? So Mukesh is absolutely right, and first to answer. So Mukesh, Priyanshi, Osama, I guess you all are right. So the four things are ADME. So of course absorption is a part, yes. Distribution is a part, yes. Excretion is a part, yes. But no, adverse effect do not comes under pharmacokinetics. That's why we all will go with C. Right? So it is a P by Q of NEET PG few years back. Coming on the next question. You can see pharmacodynamics include. What do you mean by pharmacodynamics? What do you mean by pharmacodynamics? See the four options. Is it drug elimination? Is it drug excretion? Is it drug absorption? Or is it mechanism of action of the drug? I want to see who is the first and accurate. Yes? Yes, Priyanshi. Absolutely right. And all others are also right. So it is the mechanism of action of the drug. What the drug is doing on the body. Of course, the answer is D, and everyone is correct now. Yes, very good. Now the third and the last question in front of you. Same question with different options. Pharmacodynamics deals with. I'm asking, what is pharmacodynamic? Is it effect of drug on body, or is it effect of body on drug? What do you mean by that? Is it absorption of drug? Is it metabolism of the drug? Yes, Raj, you are absolutely right, and others are also right. Very good, very good, very good. So the correct answer, it is the effect of drug on the body. D stands for dynamics, D stands for drug. Drug body पे क्या करता है? Right, so that is known as. ठीक है? So that is the pharmacokinetics and dynamics. So today we are starting a topic under pharmacodynamics. I have to teach you pharmacokinetics also completely, right? The four chapters. So there are four chapters, A, D, and E, four different big chapters with numericals. We will do all these gradually. But today I am going to teach you a topic from pharmacodynamics. So I am going to teach you today dose response curve, which is known as DRC. Right? So image based questions are going to come, or numericals are going to come in your university exam based on this topic. Okay? So it is under pharmacodynamics. I guess everyone is with me, and I shall start the topic. So let me start dose response curve, that is DRC. Dose response curve. You will say, ma'am, what is it? होता क्या है? पहले basic बताओ, मतलब क्या है? Right? Okay. Dose response curve is a graph. It is a graph. In a graph, we have x-axis, we have y-axis. So on the x-axis, we are taking the dose of the drug. The dose, how many milligram, how many gram you are taking. The dose of the drug which is reaching in the blood. ठीक है? On the y-axis, you are taking response of the drug. You will say, ma'am, what do you mean by response? Just suppose there is a patient in my clinic and the patient is having severe edema throughout the body. The treatment of the edema is diuretic. So I would like to give the diuretic to the patient. How diuretic treat the edema? Do you know that? So extra water in the body is excreted in the urine. So whenever I give diuretic to any patient, the urine output will increase. The patient will have more urine and the edema will be treated. So it is a symptomatic treatment of the edema, we know that. So the response of the diuretic is the amount of urine. So for example, I am giving 10 milligram tablet to my patient, 10 milligram. So he is excreting 1 liter of urine. Whenever I am increasing the dose, instead of 10, I am giving 20 milligram. He is excreting 2 liter of urine. So if I am doing 30, it is 3. Likewise 40, 50, 60, 70, it is 4 liter, 5 liter, 6 liter, 7 liter. Are you agree with me? Do you agree with me with this thing? It happens now. If we are increasing the dose, the response will increase. Lekin kab tak? Like this, see the response. See what I mean to say. So first you increase the dose, the response will increase. You will increase the dose, the response will increase. But after a certain point, reaching to maximum response, even on increasing dose, the response will not increase. So this is the curve. It is known as dose response curve. Dose on the x-axis, response on the y-axis. If we make a graph between them, this is DRC. Everyone give me a thumbs up if you got the basic DRC होता क्या है. हम x-axis पे dose लेंगे, y-axis पे response लेंगे, उनके बीच में ग्राफ बनाएंगे तो ये ग्राफ है. इनिशियली तो ग्राफ डायरेक्टली प्रोपोर्शनल होता है, बाद में कांस्टेंट हो जाता है. सब लोग thumbs up दो पहले. You got my point? I have told you in Hindi also, in English also. So that is the basic concept. What do you mean by DRC? On the x-axis, you are taking the dose of the drug. On the y-axis, you are taking the response. Let me take one more example. I'm having severe headache, right? Just for example, I'm having severe headache. So my disease here is headache. And I want to treat it. So I will take a drug. I will take which drug? NSAID. Some of the painkiller I would like to take, right? So I will take some NSAID. So if I take a small dose of NSAID, so just suppose the response is 10% of the headache is treated. If I increase the dose, 20% will be treated, 80% still there. So likewise, I increase the dose, I increase the dose, I increase the dose. So till a maximum response, it will be treated. After that, even on increasing the dose, it will not increase. So that is the DRC. Everyone give me a thumbs up, right? So this shape, can you appreciate the shape? Okay. So this is x-axis, this is y-axis. We have drawn the graph. The graph is this. Can you all appreciate this graph? On the x-axis, it is dose. On the y-axis, it is response. Appreciate the graph. Listen very carefully. Initially, the graph is directly proportional and later it will become constant. You cannot change x and y axis. X पे हमेशा dose लेना है और y पे हमेशा response लेना है. You cannot interchange it because the shape will change. So this particular shape initially directly proportional, later on constant. This is known as hyperbola shape. In mathematics, we have studied now. This shape is hyperbola. Now it is difficult to do calculations on hyperbola shape. That's why we want to change the shape. We cannot compare the drugs in a hyperbola, it's difficult. So instead of dose, on the x-axis, I will take logarithm of the dose. You got my point? On the y-axis, response is still same. But instead of dose, for example, please understand, I was taking 10 milligram tablet, 20 milligram, 30 milligram like this. But instead of that, I will take log 10. What is log 10? Whatever is the value. Log 20. Logarithm पढ़ा है ना? बचपन में मैथ्स में पढ़ा होगा. Logarithm 8th standard में chapter होता है, right? So I will take the logarithm of that particular value. So if I take the logarithm of the dose, the shape of the graph is changing, and see the shape. What is the shape? This is the shape now. This shape is known as sigmoid. So if I take, what is hyperbola से हो गया sigmoid. So basically, if I am taking DRC, that is dose on x-axis and response on y-axis, the shape is hyperbola, but it is difficult to calculate. So instead of dose, I am taking log dose. Log dose, response is same. So log DRC. So in log DRC, the shape will become sigmoid. I guess everyone got it. अगर ये समझ में आया तो thumbs up दो, आगे बढ़ेंगे. फटाफट thumbs up दे दो. सब लोग, आदित्य, ओसामा, मुकेश, प्रियांशी, सुरेंद्र, आशीष, everyone. Sachin, yes, are you people there with me? Good, good. So do you have any doubt why we have changed the shape? So this is the thing. This is the thing written in front of you. DRC is usually hyperbola in shape, but it's difficult to do mathematical comparisons on a hyperbola shape. So instead of dose, we are taking logarithm of the dose, log dose. So the shape from hyperbola, it will change to the sigmoid. So basics should be clear. Okay? So you can see the two graphs. You can see the two graphs. The first is DRC, shape is hyperbola. The second is log DRC with the same drug, and the shape will become sigmoid. If you got the basics, let me proceed. You can see the two graphs. The graph is from KDT only, right? You can see this one is DRC, the red one, and the blue one is log-DRC. Log-DRC. Appreciate the change in shape. If you have appreciated the change in shape, you will ask me, ma'am, okay, we understood all these, but we all are doctors. Is it necessary for a doctor to understand the shape of these graphs before prescribing any drug to the patient? बच्चे मुझसे पूछते हैं कि मैम ये सब हमारे किस काम का? ठीक है, हमने समझ लिया, but what does it mean? If I am a doctor, any patient is coming in my clinic, before prescribing any drug, shall I see DRC of that drug? Yes, you must know the DRC of all drugs. Why? It will give you 4 parameters. So that is the 4 parameters, that is the clinical use of DRC. DRC को समझना क्यों जरूरी है? We can compare the potency of various drugs based on the DRC. We can compare the efficacy of various drugs based on DRC. Looking at the slope, we can decide whether the drug is safe or dangerous. I will tell you how we will decide. And we can decide the therapeutic index and therapeutic range of the drug. So these are the 4 parameters which comes under DRC, or I must say log-DRC. Log-DRC लेंगे हम, DRC नहीं लेंगे. So we will study log-DRC in detail. You got my point? So whenever you will start practicing now after your MBBS or MD/MS, whenever you will start your clinic and you will start practicing being a doctor, so what will happen now? Whatever specialist you are, many medical representative of various brands company will come to your clinic, MR, right? They will, they will just do the marketing advertisement of their own drug. So the first MR will say, no, my drug is good. The second will say, no, my company is better. So they will offer you multiple drugs to prescribe the patient. Ki, doctor, please prescribe our drug to the patient. We are the best in the market, others are not good. And everyone will say like this. Now it is your call, it is your judgment that which drug you will prescribe to your patient, right? So you, being a good doctor, good practitioner, you should give that drug to your patient. Looking now, यहाँ पे DRC का काम आएगा. You have to see the DRC of all these. You have to compare the potency of all these. Now all the drugs are for same disease. They all are treating for the same disease. For example, these all drugs are for diarrhea, right? These all are for diarrhea. But which drug you will give to your patient? What is the parameter? There are hundreds of drugs available for the same disease working at the same mechanism. But which you will prefer? You will see the DRC, you will compare the potency, efficacy, you will see the slope and therapeutic index. Then based on your judgment, you will decide which is the best drug for your patient and you will prescribe that. Because patient don't know. आप जो prescribe करोगे patient को purchase करके लेगा. So it is the thing that you should give a right drug to the patient. है ना? So this is how DRC is useful. So what is potency? Does anyone know what is potency among you, the audience? Priyanshi, Raj, Mukesh. Do you know what is potency का मतलब क्या होता है? Does anyone know? I'm asking you. What is potency? Potency का मतलब बताओ मुझे. What is potency? Potency of the drug क्या होता है और efficacy of the drug क्या होता है? So okay, let me start with potency. Potency is the amount of drug needed to produce a particular response. Amount of drug. It is in milligram. See, on this graph, you can see 2 drugs. Drug A and drug B, right? On the x-axis, logarithm of the dose. On the y-axis response, I can see the 2 sigmoid curves. 2 different drugs are there, right? So basically, I want my patient at least should have 50% of the response. मुझे ऐसी ड्रग चाहिए कि 50% तो फायदा करे जो भी उसकी डिजीज है. At least 50% तो उसको रिस्पॉन्स मिले, आराम मिले, तो वो ठीक ड्रग है और अच्छी ड्रग है. So my cut off is 50%. So I am taking here 50%. So 50% के लिए मुझे drug A कितना मिलीग्राम देना पड़ रहा है? How many milligram I want drug A to produce 50% response? I want 30 milligram of tablet A, right? But of tablet B, I want 50 milligram. So according to you, which is better? Both are producing 50% response. I have fixed the response. I can fix anything, 50, 60, 70. I will fix one response कि मेरे patient में at least I want this response. So for producing that response, how much milligram I want of that drug? So that much milligram or gram, that is the amount of drug that is taken on x-axis is known as potency. According to you, which is better? Aditya is saying 31 is the better. So Aditya, you mean the drug A is better than B? Yes. So drug A is more potent than B because drug A 30 milligram पे ही उतना असर दिखा रहा है जितना drug B 50 पे दिखा रहा है. The drug A is showing at 30 milligram dose, it is showing the same response as the drug B is showing at 50 milligram. So it is better to give less dose, है ना? So the drug which produce the same response at a lesser dose is more potent as compared to other drug. Give me a thumbs up. Give me a thumbs up. So drug A is more potent than B. So potency, the word potency, it is measured on x-axis. On looking at the x-axis, you decided which is better. The one which is required in less amount is more potent. and the one which is required in more amount is less potent. So potency is inversely proportional to amount of drug required, and it is looked on the x-axis. Give me a thumbs up. समझता जा रहा है तो thumbs up देखो. Now in this graph, my question to you: there are three drugs. Who will answer which is the most potent? Drug A, drug B, drug C. Who will answer? Mukesh, would you like to answer? Which is most potent? My question is: tell me most potent drug. Tell me least potent drug among the three. Write the names of most potent. Aditya is saying A. Is he right? So fix the response. Again 50. I'm fixing the response. For 50, how much each of them is required? This is required 0.01, this is required 1, and this one is required 100. See the doses, how much they are required. Yes. So A is required in minimum amount and C is required in maximum. So most potent is A and least potent is C, and you all are right. You got my point? You got my point? So can I say that in DRC, the drug which is on the left side, now this is the left side, this is the right side, the one which is on left side is more potent, and the one which is on right side, this is least potent. So every time you don't have to think, just see the left, right and answer it. So this is a rule. The drug which is on left side, if you have multiple drugs on the graph, the drug which is on the most left, जो सबसे कोने में है left side में, वो most potent होगी, और the drug which is on the right side is least potent. You got my point? So among these, this one is the left, so this is the most potent. Among these, this is the left, this is the most potent. Give me a thumbs up. So rule is lefter is the drug. The more on the left side, the more it is potent. The more left side, the more potent. You got my point? So this is about the potency. So drug A is more potent than B. This is how we decided. So we are done with potency. In the potency we have learned it is seen on x-axis. Right? It is the amount of the drug. How much drug is required to produce a particular response. And left is the drug, more potent it is. So that is about the potency. What do you mean by efficacy of the drug? Now who will tell me efficacy क्या होता है भाई? What do you mean by efficacy? Potency तो चलो समझ में आया. अब efficacy बताइए. What do you mean by efficacy of the drug? Does anyone know what is efficacy? Mukesh, do you know? Surendra, you know it? Or anyone else from the audience? Osama, तुमको पता है क्या होता है? Efficacy क्या होता है? What is efficacy? Okay, I will tell you. Listen. Now can you see again same graph? ये same graph है, right? In the same graph, do you see this is drug A, this is drug B. So drug A is producing maximum response 70%, right? And after that it is becoming constant. And drug B is producing maximum response as 90%, and after that it is becoming constant. So just suppose I am having headache. My headache is 100%. The disease is considered as 100%. अभी जो मुझे headache हो रहा है, for example अभी हो नहीं रहा है. So for example, if I am having headache, that is 100%. I am taking drug A to treat it. You are a doctor. You have given me, okay, ma'am, take this drug A. The headache will be all right. So at the maximum effect, it can produce is only 70%. After 70%, even on increasing dose, the response is not treating. It is not increasing. So my headache will be cured only 70%. But still 30% headache is still present to me if I am taking drug A. But you are saying, ma'am, don't take drug A, take drug B. So if I am taking drug B, 90% will be treated and I will be having only 10%. So which is more better drug? A is better or B is better? You tell me which is better. Which is better? A or B? A is giving maximum response 70%, B is giving maximum response 90%. So 70 and 90 के बाद जितने बच गए, that is 30 or 10 is still present. So which is better? Of course everyone say ma'am B is better. So that is known as efficacy. Efficacy is seen on y-axis. We are looking at the y-axis. We are not looking on x-axis. On the y-axis it is the response. So the maximum response produced by the drug. Drug, हर drug एक अपना maximum. It is not a thing that every drug produce 100% response. No. All the drugs have different capacity. That is the maximum response it can do. After that, even on increasing the dose, it will not produce more response. So the maximum response produced by the drug is known as efficacy. Now in this graph, you tell me the sequence which is most efficacious, which is less efficacious. In this graph, you tell me the sequence. Who will tell me the sequence? See now efficacy. So A is producing maximum response as 100, B is producing maximum response as nearly 200, and C is producing maximum response as nearly, roughly I am talking 250. So which is producing the most? Yes. So C followed by B followed by A. Am I right? Yes, Mukesh, Aditya, everyone is right. So this is also what we have learned. So C is most efficacious here. So we see efficacy on the y-axis, not on x-axis. It is the maximum response produced by the drug, and response is seen on y-axis. I have told you never change the axis. On the x, always take dose, the amount of the drug. On the y, always take the response. So can I say, looking at the y-axis, taller, I am using the word taller. जो जितना tall है, वो उतना ज़्यादा efficacious है. Here there is not left right now. if you're looking on x-axis, okay, if you're looking on x-axis, this is x-axis. So you will talk in terms of, ma'am, left and right. You will talk in these terms. Okay, I got it. So we were talking about left and right in potency. But if you are working on the y-axis, we don't have left, right. On the y-axis, we have upper, lower. You can say the word upper and lower is a better word, right? So upper, lower word I can use. I cannot say x and y. I guess you are getting my feelings, what I mean to explain here, right? So efficacy, we are looking on the y-axis, so I can see taller or the more upper graph is more efficacious. So here B is taller than A, so B is more efficacious. Here C is taller, so C is more efficacious. So the peak or the tallness of the graph decides the efficacy. So what we have learned, we have learned two things till now. Everyone here on the screen. What we have learned, the two things. We have seen what is potency and what is efficacy. What we have seen, potency is measured on x-axis, efficacy is measured on y-axis. Potency is the amount of drug which is needed to produce a particular response, and efficacy is the maximum response that can be produced by that drug. To see the potency, we have to see the left. More the left the drug is, it is most potent. To see the efficacy, we have to see the height or the tallness. How tall, the height, the peak of the drug. More is the peak of the drug, more is the efficacy. Everyone give me a thumbs up on the summary. Is summary pe sab log thumbs up do. You got my point? Say, if you got my point, say. So in your entire pharma book, whatever book you are using, you will get all these lines. Pure chapters mein milengi. Like aspirin is less potent and less efficacious than morphine. Aspirin and morphine both are NSAIDs. They are both analgesics. I'm sorry, both are analgesics. One is NSAID and one is opioid. But both are analgesic. So aspirin is less. So you should have an understanding ki less potent ka kya matlab hai, less efficacious ka kya matlab hai. Chalo, right? Now my question is, which is more important criteria to decide for the patient? Potency is more important criteria or efficacy? You are a doctor now. Which drug you will select for your patient? Which is more potent or which is more efficacious? Which you will select? You have to select now. For example, you are a doctor and you are a GI specialist and you treat the patient for diarrhea, right? Now two different MR, two different companies are doing the advertisement. Doctor, please sell our drug to your patient, right? We are having drug A and that is the best. Of course, वो तो अपना ही best बोलेंगे ना. Another MR is coming, doctor, please sell our drug, right? You prescribe our drug to a patient, we are better than A. A will say we are better than B. So तुम दोनों की सुनो, right? तुम बोलो okay, but you do your own judgment. Now you see the graph of both. You ask the MR to or the person to show the graph, the DRC of your drug. Then I will do the comparison. Now you do the comparison. Tell me in terms of potency which is better and in terms of efficacy which is better. Apply the formula. Potency is on the left side. So I guess A is on the left side. So potency wise, A is more potent than B. Yes. Efficacy is the tallness, but B is more taller than A. So B is more better than A efficacy wise. So you will get confused. Now what you will prescribe to your patient? What you will ask? So you cannot tell all the things to your patient ना कि potency wise तो ये अच्छी है, efficacy wise तो ये अच्छी है, अब मैं सोच रहा हूँ कौन सी दूँ तुम्हें, ऐसा नहीं है. So what is more important criteria? I'm asking you. So ये तो धर्म संकट में फंस गए तुम. Potency wise A is better, efficacy wise B is better. What you will prescribe? So my question to you, what is the more important criteria? Now use your judgment now. Use your judgment. Efficacy is more important criteria. If it is different now, so go with efficacy. Efficacy is more important criteria. The drug which is more efficacious, give that drug only. We will ask, ma'am, why efficacy is more important criteria? See again, imagine the same disease. पूरा scenario imagine करो, मैं patient हूँ. I am the patient, I am having headache. My headache is 100%. If you are giving drug A to me, I have to take only 30 gram. But the maximum response is 0.7 only. My headache will be treated only 70%, not more than that, even on increasing dose. And I have to take only a small tablet, 30 milligram, right? If you give tablet B to me, my headache will be treated 90%. Only 10% a small amount will remaining, but maximum almost it will be cured. It will be treated. But yeah, for that I have to take 60 milligram tablet. So being a patient, what I will prefer? I will prefer doctor साहब छोटी गोली की जगह बड़ी गोली ले लूंगी, कोई प्रॉब्लम नहीं है, 2 टैबलेट ले लूंगी मैं, लेकिन कुछ ऐसा दो जिससे आराम मिले. You got my point? So this is in layman language, patient language. They want more effect. The dose doesn't matter for them. So whether you give them a 30 milligram tablet or 60 milligram tablet or 1000 milligram tablet, how does it matter for the patient? Patient don't understand. आप लिख दो dose जितना भी है, but efficacy matter. Patient will call you, doctor अभी भी ठीक नहीं हुआ, अभी भी ठीक नहीं हुआ, give me more dose or give me another drug. So the response is more important clinically. That's why I always go with efficacy. Give me a thumbs up. Everyone give me a thumbs up, right? So drug A is more potent, B is more efficacious. So efficacy is more important criteria. It is the decisive factor. Everyone give me a thumbs up. Everyone, you got the reason why? You should know the reason. Now I will ask you few questions. You have to answer in the chat box looking at the graph. So this is the first graph. Let me ask the question. Look at the graph. Can you see the graph? See, the graph is log-DRC. You can see the three drugs. Drug A, drug B, drug C. In that, my first question to you, compare drug A and C in both terms. In terms of potency, which is better. In terms of efficacy, which is better. So first, in terms of potency, give me the answer. Compare drug A and C. Don't look at B. Compare drug A and C. Who will tell the answer? Osama, what is the answer? In terms of potency, what is the answer? What is the answer? Yes? In terms of potency, look at A and look at C. Potency wise, which is on the left? The one on the left is more potent. It is a rule. So I guess A is on the left and C is on the right. So I will say A is more potent than C. Why you people are not writing the answer? Yes, Aditya, absolutely right. Yes, yes. So potency wise, it is A better than C. And efficacy wise, what do you mean by efficacy? Efficacy is the tallness. I can see both are equally tall. So I will say A is equal to C, right? So A is more potent than C and A is, so which you will give to your patient? A ki C, which you will give to your patient. Now this is scenario in front of you. There is a drug A, there is another drug C. Potency wise A is better than C, but efficacy wise both are better. You will say, ma'am, efficacy is the decisive criteria, but efficacy to same hai. To go with potency. The second most decisive criteria is potency. So being a doctor, I will give A drug to my patient. Efficacy to same hai na, so I will give more potent drug. So my final answer will be A. Right, this is the scenario. Now, okay, so we have written that, we have seen that. Now everyone please participate. Now compare drug A and B. Don't look at C. Compare drug A and B. Compare drug A and drug B. First compare their potency and then compare their efficacy, and then we will take a call which is better for the patient from A and B. So first tell me their potency. Potency wise which is better? The potency wise most of the students are saying A, because of course you can see it is left, it is right, but hardly any difference is there. यहाँ से शुरू करोगे तो hardly I can find any difference. Hardly, small difference. So I can neglect it. I can neglect it because the difference is very, very minute, you can see. Right, Matt? Very, very. But yeah, this difference is much. But this difference is very, very minute. So I will say potency wise, A is equal to B. Almost I can say A is equal to B. Give me a thumbs up. But what about efficacy wise? Now in the efficacy, please compare the tallness, height. Who is taller? C on the y-axis. So of course A is taller than B. Right? So here I will say A is better than B. A is better than B. Now take a call for your patient. Look at the scenario. This is my scenario. So I am having two drugs for the same disease. I am a doctor. The two MR are comparing. Please doctor prescribe our drug. Please doctor prescribe. So I will use my judgment. There is a drug whose potency is same. Potency दोनों की same है. But efficacy wise A is better than B. Again I will prescribe A. Again I will prescribe A. Right. So here the scenario was efficacy was same. So I am going with the potency. Here the reverse scenario, potency is same, so I am going with the efficacy, right? I am going with the efficacy, right? Now compare drug B and C. The last question, compare drug B and C. Don't look at A, don't look at A. Compare drug B and C. First tell me their potency, then tell me their efficacy. I am telling you the answers. Listen now. Potency wise, this is on the left, this is on the right. So B is better than C. Efficacy wise, you have to see the height. So C is tall and B is short. So C is better than B. Now it's the Dharam Sankat. This is known as Dharam Sankat. What you will prefer? What you will prefer? Potency wise, B is better. Efficacy wise, C is better. तो कौन सा प्रिस्क्राइब करोगे? दोनों एमआर लड़ रहे हैं कि नहीं हमारी अच्छी है, हमारी अच्छी है. ये बोल रहे हैं हमारी तो पोटेंसी में अच्छी है, ये बोल रहे हैं हमारी एफिकेसी में अच्छी है. तो being a doctor, what you will choose? Of course, being a doctor, we will choose C. We will give more weightage to C. We will give more weightage to efficacy. So I guess you got it. I guess you got it, right? So the same question can be asked in many graphs, and you will get many MCQs on this. These are the graphs. Can you compare the four drugs here? Four graphs. Drug A, drug B, drug C, drug D. You can see the four sigmoid, I guess. Let me ask the question. Can you compare drug A and B? This is how many questions are there. Can you compare drug A and B? A and B. Tell the potency. Priyanshi, tell the potency of A and B. Can you compare? Who is having more potency? Priyanshi, can you tell me? Can you tell me? So Priyanshi, can you tell me the answer in this graph? I guess you are telling the answer of the last one. Potency wise, yes, the potency wise A is on the left side and B is on the right side. So of course A is more potent than B. And efficacy wise, what about efficacy of A and B? Who will tell me? This is potency. ये तो potency हुआ. What about efficacy? Who will tell me the efficacy of A and B? So yeah, they are equal. I can see the equal height. Equal height. So A is equal to B. So this is how we can apply. We can apply the same. We can apply the same on all of them, right? This is how. So I'm skipping many questions are there. You can't imagine. So we have done what is potency. We have done what is efficacy. Potency seen on x-axis. Efficacy seen on y-axis. X-axis, it is the amount of drug needed to cure a disease. It is the maximum response of drug which is produced by a drug. It is more on the left side, more potent. It is more tall, more efficacious, right? And more important criteria is efficacy, not potency. So this is the summary till now. This is the summary till now. Let me come on the third parameter. The third parameter is the slope. The third parameter is the slope of the drug. What do you mean by slope? Slope का क्या मतलब होता है? Now see, these are two different drugs. Both are anti-hypertensive drugs. Anti-hypertensive drugs. Have you heard the names? Hydralazine and hydrochlorothiazide. Hydralazine, it is a vasodilator, right? If you know the classifications in pharmacology, you may be knowing that. And hydrochlorothiazide, it is a thiazide group drug. It is a diuretic, I mean. It is a diuretic, that is thiazide diuretic. So both of them are anti-hypertensive. Imagine I'm in my clinic there is a patient is coming and the patient is hypertensive. So I want to treat, of course, the blood pressure of my patient, and I want to give one of the drug. So I'm having two options. Either I give hydralazine or I give hydrochlorothiazide. So what I will prefer in the two? Now I'm not looking at the potency efficacy. Potency efficacy wise मैंने उनको compare कर लिया. After that now I have to see the slope. What do you mean by slope? एक एक करके दोनों का slope देखते हैं. See, listen. The first slope पहले आप देखो hydralazine का. Listen, if I am giving 10, let me write 10, 20, 30 here to explain you. 50, 60, 70. Right, let me write 10, 20, 30 here also. Just to explain you the example, just to explain you the two type of the slopes. Listen now, listen, the first example. Take hydralazine ka graph. So if I am giving 10 milligram, the patient is having 10% response. I am giving 20, the patient is having 20. So on 30, it is 30. On 40, like you know, the response is increasing with the dose drastically. I'm increasing the dose, the response is increasing drastically. What do you mean by response? Responses fall in BP, right? They all decrease the BP of the patient to treat the hypertension, right? So I want to give a moderate dose so the BP will become 120 by 80. Currently the BP is more. My patient, just suppose BP is having 160 by 100 and I want to make it 120 by 80. मुझे ज़्यादा कम भी नहीं करना है. ऐसा भी नहीं कि I want to do BP 60 by 40. Patient will go in shock and patient will die. I do not want to give excessive response. I want to give a moderate response. So I will weigh at what dose that 120 by 80 will come. You got my point? So this is hydralazine. This slope is known as steep slope. Steep ka matlab on increasing dose, the response also increases, right? So you always start with minimum dose. Give a 10 milligram tablet and see how much is the response. Then give 20 if it is not coming 120 by 80. Then give 20. Then gradually shift to 30. At the dose at which 120 by 80 is achieved, just fix at that dose. This is how we do graduation. Give me a thumbs up if you are getting what I mean. Give me a thumbs up. Right? Right. So give me a thumbs up. So that is the first slope. That is the first slope. Now let me explain you. Just a second. Okay. Give me a minute. Explain the second type of the response in the same curve. Now let me talk about the hydralazine. Look at hydralazine. So this is 10, 20, 30, 40 like this. Here also we are having 10, 20, 30, 40. So see here, I am giving 10 milligram, the response is 10. Even on 20, the response is 12. Even on 30, the response is only 15. Even on 40, the response is hardly increasing. So I am going to increase the dose drastically, but response is not increasing or hardly increasing. So this is known as flat. We can see it is almost flat. You got my point? So this one is steep and this one is flat. You tell me which drug is safe for the patient. Which drug is safe? The steep graph or the flat graph? For example, I have given a drug with the steep graph. I have given hydralazine to my patient. So I have given a 10 milligram tablet. And patient by mistake, instead of 10, patient purchased the 20 की doctor तो ऐसे ही लिखते हैं अपन तो 10 की जगह 20 ले लो. Patient by mistake, so patient can go in hypotension and patient can die, patient can go in shock. So because on increasing the dose, the response increases drastically. You got my point? So the steep one are the dangerous. but the flat one are very safe. You got my point? Instead the patient take 10, 20, 30, hardly any increase in responses there. So that is the drugs which are safe. You got my point? So basically we are having two types of slope, the steep slope and the flat slope. You got my point? Steep slope, on increasing the dose a little bit, response increases drastically. This is known as steep graph. Flat, on increasing the dose, response do not increase or hardly any increase. This is known as flat dose. So flat slope. Here these are dangerous and here these are safe. This is my summary. Give me a thumbs up. Give me a thumbs up. So based on that, you can decide which is a better drug for your patient. You got my point? And if you are giving a drug for the steep slope, you will warn the patient, whatever dose I have prescribed on my prescription, please take that dose only. Don't increase the dose by your own wish. So before increasing or decreasing, changing the dose, give me a call or ask me. You cannot do it by yourself. It is a dangerous drug. You have to warn your patient. And if you are giving flat, there is no risk in that. You got my point? So we are done with potency, efficacy, slope. The last thing is the therapeutic index. The last and the fourth parameter is therapeutic index, also known as safety margin. You got my point? Now what is it? Listen, can you see the two graphs? The two graphs are not two different drugs. There are two DRC, DRC1 and DRC2. I can see the two DRCs here. But both the DRCs are of same drug. It is not drug A and B. It is the same drug. यहाँ पे अब हम same drug लेंगे. For potency, we have taken multiple drugs and compared them. For efficacy, we have taken multiple drug DRC and compared them. A, B, C, D, कितने भी ले सकते हैं. Slope के लिए भी we have taken multiple and see कि किसका flat है, किसका steep है. But for therapeutic index, we are taking only one drug. We are taking the same drug, one drug, and drawing the two graphs for it. You will say, ma'am, same drug के दो graph कैसे बनेंगे? Listen, whenever I give any drug to my patient, I want the drug to do its effect. Effect का मतलब होता है action, right? But by default, every drug do side effect. Side effect हर drug का होता है. Side effect. The unwanted effects of the drug are the side effects. So every drug have effects. Every drug have side effects. Do you agree with me? Every drug in the world. So these are the two DRCs. This DRC is of effect DRC, and this DRC is of the side effect. This DRC is of side effect, but both the DRCs are of the same drug. ये दूसरे drug नहीं है. पहले तो ये समझो, it is not drug A and B. No, it is the same drug. Drug A, drug A. But this is effect DRC. This is side effect DRC. First, give me a thumbs up on this point. First, give me a thumbs up. There is some disturbance in the noise. I am having a power cut off at my place, and this is the inverter sound. You know, so it will be there till the power will come. I guess it is not distracting you. And shall I continue the session? Shall I continue the session? It is not distractive, right? So I will continue. So there are two DRCs, I guess, the effect DRC and the side effect DRC, right? Now, so the more is the gap between the two, the safer is the drug. For example, I am taking an anesthesia drug to anesthetize my patient. I am an anesthetologist, okay? So I want the drug to sedate my patient. I want the drug to sedate my patient. But if I increase the dose at high dose, it can cause death also. So death is the side effect. Death is not, I do not want death. Death is a side effect. It can happen on high dose. But the sedation is the effect. I want in my patient the sedation. I do not want in my patient the side effect. The death, of course, right? So I have drawn the two DRCs. Give me a thumbs up. So I have to see the gap between the two. They are separated. वो कितने dose से separated हैं? Listen. For that we are taking 2 points. 1 point on the DRC effect wala, 1 point on the DRC side effect wala. So on the effect, this is the point ED 50, effective dose 50. So at this, it is the dose at which 50% effect is there. The dose at which 50% effect is there, that dose, that is 10 milligram पे 50% effect आ गया. That dose known as ED 50, right? And this dose is known as LD 50. The dose at which 50% of the person will die on that dose, that is known as LD 50, lethal dose 50. You got my point? So if I give 10 milligram tablet, my patient will have effect, 50% of the patient. If I give 50 milligram tablet, my 50% of the patient will die. So 10 and 40, you can see the difference. You got my point? So I will take a ratio, LD 50 by ED 50. That is 40 by 10. That is answer is 4. This is known as therapeutic index. So 4 times का margin है. आइडियली मुझे 10 मिलीग्राम ही देना चाहिए, 10 से बढ़ना नहीं चाहिए, लेकिन बढ़ के मैं 20, 30, 40 कभी टच नहीं करना. If I touch 40, patient will die. So more, I want this number to be more, drug will be more safe. more is the answer, more safer is the drug. ये 4 की जगह अगर 5 होता तो हम और safe zone में होते, 5 की जगह 6 होता तो हम और safe zone में होते. You got my point? So what is therapeutic index? Therapeutic index is the gap between two DRCs. Which two DRCs? The therapeutic DRC and the adverse effect DRC. Between two DRCs, we are looking the gap between them. To look the gap, we take 2 points on them. ED50 is a point on the therapeutic DRC and LD50 is a point on the side effect DRC. And we are taking the ratio between the two. In the ratio, we have a numerator, we have a denominator. The numerator is taken here is LD50. LD50 को numerator में ले लो और ED50 को ले लो denominator में. You take ED50 in the denominator. ये ratio के answer को कहते हैं therapeutic index. You got my point? So this is therapeutic index. You got my point? If you give 40 milligram to your patient, patient will die. So this is LD50. If you give 10 milligram to your patient, 50% effect will be there. So the ratio of 40 by 10, that is LD50 by ED50. This is known as therapeutic index. This is the formula of therapeutic index in front of you. So LD50 upon ED50. Don't do the reverse. It is not ED upon LD. It is LD upon ED. So always remember the numerator, always remember the denominator. Always remember. So median lethal dose or median effective dose इस ratio को कहते हैं therapeutic index. I want thumbs up from everyone. You got my point? You got my point? You got my point? क्या होता है therapeutic index? So therapeutic index is the ratio of LD50 and ED50. The drug which is having high therapeutic index are safe and the drug which is having low therapeutic index are very dangerous. है ना? So just for suppose this drug is a dangerous. If I am writing patient to take a 10 milligram tablet, by mistake patient is taking 40 milligram, patient will directly die. मर ही जाएगा. Patient will die. So I cannot afford that. I cannot afford that. It is a dangerous drug. So this ratio should be, the gap should be more. ये दूर दूर होने चाहिए. दोनों ग्राफ जितने दूर हैं उतना तुम safe हो. Because the complete responsibility of your patient is yours. If you are giving such drug to your patient, now you have to warn. Patients are laymen. They don't know anything. They are from villages. They are from periphery. They don't have understanding. They always think, okay, डॉक्टर ने तो 10 लिखा है, ठीक है. असर नहीं हो रहा ना, एक और ले लो. असर नहीं हो रहा, एक और ले लो. फिर से कौन जाएगा डॉक्टर के पास? That is their mentality. You know. So they will increase the dose by themselves without even asking you. So you are not aware and patient can die. You will already get a call that patient is dead and now they will do a medical case on you, the legal case on you. So you will be under trouble. So these drugs are dangerous. Whenever you are writing such a drug to your patient, you have to warn your patient. You have to give clear instructions to your patient. You got my point? The drug with low therapeutic index, the drug with high therapeutic index, right? The drug with low therapeutic index are dangerous and the drug with high therapeutic index are safe. What is therapeutic index? So therapeutic index is a ratio in which we are having a numerator, a denominator. The numerator is LD50, the denominator is ED50. The ratio ka answer we have to see it is low or high. Give me a thumbs up if you all got it. So that is about the therapeutic index. So we are done with the parameters and we have done the everything about the DRC. So looking at the DRC, we get 4 clues. What are the 4 clues? We get potency, efficacy, the slope, the 2 type of the slope, and the last one is therapeutic index. Everyone give me a thumbs up. So potency. So potency more on the left, more potent it is. So we have to see left, right, right? For efficacy, we have to see the tallness. Who is the most height, right? So that is more efficacious. For slope, we have to see whether it is flat or whether it is steep. This one is steep and this one is flat. The steep one are dangerous and the flat one are safe. And for therapeutic index, we have to see the gap between two DRC. More is the gap, safer is the drug. Less is the gap, dangerous is the drug. To measure this gap, we have a term therapeutic index, which is a ratio of LD50 upon ED50. Everyone give me a thumbs up, right? So that's all about the session. Don't hesitate to ask any of your doubt on my personal contact number. It's 9833032948. This is my contact number. Please get in touch either on WhatsApp or Telegram on this number. By the way, in the comment section, you can in the live chat also and later on in the comments also, you will see a message is pinned. You can see it right now. The first message is pinned. So in the pinned message, if you click on the link, you can connect me with all the social medias. There is a WhatsApp group invite link. If you wish, you can join my WhatsApp group. You can join my Telegram. You can join my Instagram. You can join my YouTube channel. You can join me on the Facebook also. So you can join me with more and more social media. The link of all the social medias is given in the comment section, right? So please don't forget to tell me your college name, your university, and your probable exam dates and what exam you are targeting. I can help you with the schedule, right? So thank you very much for being with me. Always remember one thing: if it were that easy, everyone would be a doctor. It is not an easy job. If it is that level easy now, then everyone will be a doctor. You can see everyone is not a doctor. This is the best job in the world. And despite everything, because of everything, you are going to be a doctor. Once you get your degrees now, you are going to be a good doctor, the best doctor. It is the best job in the world, I can say. It is not that easy. You are doing hard work now, I know. You will compare with your friends who are in engineering, who are in MBA, who are there, where they are enjoying, they are, masti kar rahe hain, maze maar rahe hain, life mein settle hain, they are earning more than us, they are settled, get married, have children, and we are lagging everywhere, we are just studying. ये feeling बहुत बार आएगी. But always remember कि इतना easy होता ना तो सब कोई बन गया होता. सब कोई नहीं है डॉक्टर, तुम हो, because you have the capacity. So always remember, be motivated, study hard. Still, if you have any doubt, don't forget to get in touch with me. Don't hesitate even. Consider me as your mentor, along with your teacher, along with your motivator, right? So I can always motivate you for your studies. If you have any studies related queries, anything about it, you can ask me. So thank you very much. If you like the lecture, don't forget to click on the like button before leaving the session. Please share the links of these of my YouTube channel with all your batchmates, colleagues, all the medicos throughout the globe, and subscribe our YouTube channel. Don't forget to click on the bell icon if you want to get notification. Tomorrow at the same, I came daily 9 a.m. in the morning live, right? Daily. Tomorrow I am going to teach you a very important topic in pharma, the autonomic nervous system. Don't dare to miss it. Don't even you dare, right? So try to attend it live. It's a very important topic. It will make the base of the pharma. If you are missing it, you are doing a great mistake. So thank you very much. Bye bye. Study hard. All the best. I'm ending this session, right? Okay.